I'm Dr. Rick Greene from the medical school class of 1970, and it's a pleasure to be the host of this program where we get to talk with our emeritus professors at the University of Virginia School of Medicine. And it's my great opportunity today to talk to Dr. John Kattwinkel, Professor of Pediatrics, Director of the Neonatal Care Unit, Neonatal ICU, many titles. John, welcome.
Thank you.
So obviously the whole area of neonatology has changed drastically, let's say, since you started training. I know you've been involved in many things, and we'll get to some of those, but what inspired you not only to go into pediatrics, but eventually into neonatal care?
Well, it was a long haul. Went through many bumps and bridges and all, but I actually started, graduated from high school and went on to Rensselaer, RPI, as an engineer because I liked to fix my car and tinkered with radios and things, and I thought, gee, I guess I ought to be an engineer. And so I went to RPI and hated it. I saw myself at a drafting table. This was all pre-computers, of course, and saw myself at a drafting table for the rest of my life. And I said, I can't keep doing this. So I went on into architecture because I liked their lifestyle and the nice people, and found I had absolutely no talent. And then my father was a doctor, highly respected doctor, and I guess that's the reason I didn't go right into medicine, sort of rebellious, but I thought, that really interests me, so I talked to folks in biology and changed my major over to biology, and everything was wonderful from then on. I was fascinated by the physiology and all, and went on to Dartmouth for 2 years because my grades weren't great as an engineer. They were fine once I got into biology, but I was already 2 years into college then. So then I took a semester off so that I could get my pre-med in, and so then when I applied to med schools, I kept getting back all these rejections because of my earlier grades that were about C level, and finally I got on the wait list at Dartmouth and got in. And it's been this smooth sailing ever since.
Did they have a 4-year medical school then?
2 years.
They had a 2-year, and then you went to Harvard
Right.
for your last 2.
Right.
That's right. Before they had their 4-year school.
It was the best arrangement you could have because you had the best of all the faculty in basic sciences in the first 2 years, and then the best of all the clinicians at Harvard in the last 2. So it was a wonderful training.
Well, I sort of understand now that initial feeling about engineering, because you, in your career, you've really spent a lot of time looking at the physiology, the respiratory physiology of babies, preemies.
Right.
I was really so interested in your work with sudden infant death syndrome, leading the task force that really developed that. Tell me about a little of that work and what it finally led to. I think that's incredibly important.
Well, that was in 1990 when I got asked by the executive director of the American Academy of Pediatrics if I'd look into this issue about babies sleeping on their backs, because there were a number of publications that had come out almost exclusively from overseas, in Europe and Australia, essentially none from the US, that said that if babies sleep on their back, it's safer. And we couldn't believe that then, because my children always slept on their stomach as babies, and you didn't want them to throw up and aspirate and all that. and I spent some time in China a little later on, and that was before we had done the SIDS investigations, and I went into the nurseries there, and all the babies were on their backs. And I said to them, you can't do this. I was the expert coming over, and I said, you know, all your babies are sleeping on their backs. You must turn them over. So I left the nursery in China, in Hangzhou, and then I realized I'd forgotten my briefcase, so I went back in. And well, before I left, they turned all their babies over on the stomach, and there were probably 75, 80 of them in there. And when I went back, they were all in their back again. And I said,
for a good cause.
Well,
That's good.
I didn't know at the time, and I said, why did you do this?
Yeah.
And they said, oh, very dangerous for babies to be on their backs, because if they spit up, they're going to aspirate, which is exactly, of course, what they say, thing we said about being on their stomach being dangerous. So anyway, so the reason that they asked me to look at this, and I was over in Romania at the time because we were doing a study for another AAP project, and I was looking, and they handed me, they sent me this big pile of papers, and they said, you know, we're getting these from our membership saying that there's something about back sleeping being better than stomach. So I remember going through and reading these because I'd heard all the presentations before, so I was in the back of the room going through these papers, and I said, this is phenomenal. I didn't know anything about it. So then I chaired a task force. John Brooks and David Meyerberg were the other two on my task force, and John was a wonderful epidemiologist. So we organized all these papers, and we said, this is very impressive. Even some controlled studies and all showing that the SIDS rate went down. So presented this to NIH, and NIH said, oh, you can't make this change. All our babies are always sleeping on their stomach. It's
heretical.
Yeah, right. It was awful. And but NIH did a great job, and this was all done in a period of about a month. They organized an international conference. We all got together. We presented what our findings were from this massive review of the literature. And the statistician said, well, you know, the thing about this is that when you control for sleep position, clearly there's a relationship with outcome and with SIDS. But when you control for confounders, the relationship actually increases, which is unusual in statistical. Anyway, so the Academy, the three of us made a presentation at the spring meeting that babies should be sleeping on their backs, back to sleep. And NIH couldn't quite know whether they were going to buy into this, so they started following the National Center for Health Statistics, which is monthly statistics. And we made the recommendation, and of course I was on the Today Show, and it was all very big in the press.
Right.
And people didn't know, this seemed like be blasphemy. But we followed very nervousness, followed the statistics, and sure enough, after about 2 months, the level came down a little, then came down a little, and after about 2 years, it was very clear that the rate was dropping. And at the same time, NIH had done surveys of how babies were sleeping and found that the sleep position was changing. The amount of prone sleep was starting to drop off. And then the rest was history. Then there was the Back to Sleep campaign that was set up, and with a lot of other organizations that bought into it. And the SIDS rate fell by about 55% over the next 8 years. I mean, there were 2,000 fewer babies each year dying from SIDS, and the prone sleeping fell from 70% down to 15%.
Well, this is an incredible contribution.
It was,
and I
well,
know you're proud of it.
Well, I'm proud of it in sort of orchestrating the analysis, but
Yes.
none of that is my original research. It was
Yes.
all superb epidemiologists
Right.
from around the world, except
Right.
for the U.S. And then the U.S., of course, bought into it too, and there have been a lot of studies since then. But
So I have to ask you now, after all of these years and training all of these young people, and you've now sort of transitioned outside the medical center, what are you doing?
well,
What are you doing to keep active?
my brother's a rheumatologist, and he's 5 years older than me, and he had one of his patients who said, "Dr. Kattwinkel, if you're going to retire, you must have a plan." And I think that's true. I'd be going crazy if I didn't have a plan. And my plan was I got an NIH grant to do a multi-center trial in neonatology. So that's taking a fair amount of my time.
So people usually say they're going to travel, they might play more golf. You're getting an NIH grant at this particular junction of your life.
You know, I love what I do.
Well, of course, that's wonderful.
And I'd hate to stop doing what I do. We have a breakfast group that gets together. A bunch of us came to UVA about the same time, and we retired about the same time.
Yeah.
And we've got one fellow in there, and we said, "What are you doing now, Bill?" And he said, "Well, I get up and I walk the dog, and then I read the paper, and then I walk the dog."
We're very lucky to have had you here for many, many years as a faculty member, and obviously you're going to continue to do some wonderful work in the area of pediatrics and neonatology. And we've been talking to Dr. John Kattwinkel today, who's professor of pediatrics, the director of the neonatal program here, and has done so many things in his life. And John, it's just a pleasure to have you here. Thank you so much for being with us today.
Glad to do it.